Hey everybody, welcome to Hyperbaric Plus for another week with I don't know, I guess it would be the two maybe, but Keith Bishop with prevail.com and Josh Fate with Ultra Botanica. Both of these guys are nice enough to come in every Thursday. We dive at 10 o'clock and then we get out at there's a lot of conversation that goes on in the chamber. So my clients get the benefit of having these guys as a captivated audience for an hour at a time. And I get a lot of feedback how awesome you guys are in the chamber.
Great.
And the other deal is you're getting feedback from them, what they're up to, and that circle of influence continues to grow. This Facebook Live is a large part of that too. Keith's got a tremendous following. I'm trying to steal clients from him, but it hadn't happened yet. But I welcome everybody here. We're going to take off with empowering people with cancer to act on blood tests. So Keith's, his line is, don't guess, assess. So here we go. Keith, take it away, and we'll go from there.
Great, thank you. So today we have a round table going. We're passing out handout notes, and so matter of fact, thank you, Paul, for hosting this weekly, and so, we're making adjustments on our cameras, trying to get. Thank you for hosting this on a weekly basis. It is great information, and the handout that we have also available at prevail.com. Learning Center at the bottom of the page, so you can download that. And you put it, Betty, put it on your website. Okay, and so handouts available. This is going to also be on Instagram Live. Did we put it on Facebook? Doing Facebook?
Yeah, we're live, but I'm seeing a little technical error that I don't know
if it's working.
Who we are.
It's on Instagram. I know it's there long term, so we have thousands of people that do watch this. Today we're kind of continuing what we've been doing about assessing and assessing, about tests that you can do primarily, but also today we're going to be covering kind of more like blood tests, basic blood tests, and what these numbers mean, and then and so it's very important type information. And I want to stress that it's important to seek help. Even though what we're covering today is fairly easy to understand, but get to the source of the problem. And if there's a value that is outside the normal range, there's a reason behind it, and we have to address that. So don't just back off, but seek help with that. So the purpose of education and seminar is to basic information so that you can be and can make choices about how things are going. A lot of times you like to do these very basic tests on a regular basis. And most of my clients are actually active in treatments, and they're also doing blood every 3 weeks, if not every month. But even you can follow up with this. I've got links to more information about how you can do this on your own. So the game is very important, and before things get bad, it's very important. So, and these tests are in most states. You can also get tests without a doctor's order. So to go without the doctor, but you can also be more proactive and reactive and seek help. So I've had clients with numbers that were balanced. I gave them information about what this could mean, and to the doctor, there was a problem that needed to be addressed. So they're very important. We'll just jump into that. A comprehensive metabolic blood panel, once again, common with this all the time. Matter of fact, if you go on a yearly basis to see a doctor, or if you're going monthly or every 3 or 4 weeks or 2 weeks sometimes therapy, they're doing this test. They may be short versions and may not have all these numbers. I'm not going to go through every single part of that blood test. I'm going to go through a few things that I see as frequent issues, health challenges, and then what to do about that. So a common thing is going to be elevated creatinine and low GFR. GFR stands for glomerular filtration rate. And and also elevated BUN, blood urea nitrogen. This can, indicate some kidney stress issues, dehydration, kidney disease issues. Things that you can do about that, include stay hydrated, consider kidney support, and nutrients are going to be very important. For example, some of the nutrients can include curcumin and C. So I've actually, matter of fact, recently had a client with cancer, and I think, if I remember correctly, she had one kidney, and her kidney number was actually kind of low, which is not unusual. There is a little bit of redundancy God has given us. We can survive with one kidney, and so going to make a change?
Yes.
Oh, wrong one.
Oh,
That's why.
okay.
We're swapping
There's
out
a
mics here.
technical difficulty.
They found out the technical
Yeah.
problem. Probably picked up the wrong one. Okay, there we go. And so she only had one kidney, and her numbers were low. And I said, sure, we'll watch this. And then actually, over a couple of months, we saw her kidney numbers get better. So by doing healthy things. So that's part of our goal, is to get healthier as we're going through these challenges. And so the kidneys, as a matter of fact, our body, our kidneys, our liver are actually pretty resilient. If we can make enough changes and adapt, we can actually see the body getting better. And these tests are one way to do that. So one of my favorite supplements, curcumin, is an antioxidant, anti-inflammatory. And then NAC, N-acetylcysteine, is an antioxidant to help with that repair of the cells in the body. And before I forget, also going back to the kidneys, the most common cause of kidney disease is actually poor circulation and diabetes. Diabetes creates poor circulation. So poor circulation, atherosclerosis, and or diabetes, blood glucose levels elevated can damage the blood vessels, contribute to some type of a plaque issue, decreased circulation. And so once we start addressing circulation and blood glucose levels, the kidneys often do get better. But we have to address those underlying circulation issues.
And I think we're leaving out the one supplement people are typically taking when they're in that condition is refined sugar.
Yes.
And high fructose corn syrup.
Exactly. So I didn't put that in the sheet, and that's what I wanted to talk about. That is, blood glucose is extremely important, and if you are overweight, if you have excess body fat, there is an issue with blood glucose, and that does increase the risk of the number one cause officially by the government, by the FDA. Number one cause of kidney failure is diabetes. So very important to get that blood sugar under control. And that's also actually the next supplement on this list is going to be alpha lipoic acid. It is an antioxidant, so repairs cells in the body, but also great at taking it before meals to help lower blood glucose levels. And therefore, that's also in part how magnesium and zinc also help out, with blood glucose levels, and therefore indirectly helping with kidney function by improving circulation. Magnesium also helps blood vessels to relax. When blood vessels relax, they actually do this. They open up. They get bigger. So magnesium is very important for that. Zinc is important for blood sugar, and we'll probably talk about that in a little bit, but zinc is actually incorporated into the insulin molecule itself. So zinc supplementation is important with that. We're going to talk about testing on zinc in a little bit too.
I'd add berberine to the list.
Oh, yes,
Just
berberine.
as berberine.
Matter of fact, it is something I almost always add in anyway. So berberine is extremely important for blood glucose. And as a matter of fact, it's interesting. Berberine, I can go into the medical journals and do a search on whether it be kidney function, or as a matter of fact, even I help a lot of people, and especially women, because they know about it. Men have the same problem about bone density. Berberine even helps improve bone density. Well, bones are an organ with blood supply. And if we're getting the little tiny blood vessels plugged up due to diabetes issues, and now we get low circulation to the bones, and now we've got problems. So it is. So berberine is one of my favorite supplements. I should have added that in there. We'll do that now. I'll put that in the supplement on the download too. Okay, and then high or low sodium levels. High sodium, might be from excess salt, but I've yet to really see that salt intake. The body and the kidneys and the adrenal glands help control that sodium level, and so that's not always an issue. But dehydration or stress-related issues, and that actually comes back to the adrenal glands. And we've mentioned before in some of these seminars, the adrenal glands control the sodium. They tell the kidneys what to do with the sodium. And if the adrenal glands are fatigued, they can't send out the right signals, and so now the kidneys are letting the sodium out into the urine, and blood levels start decreasing. So a person that has had a lot of stress for a long period of time, and senior citizens have a tendency to have issues with this, and the low sodium. So part of that is also sometimes a little bit of a dizziness or lightheadedness, especially upon standing, is one of those signs I look at. And so often a person will feel better actually by taking salt and increasing that salt, in their body, especially if their blood pressure is not high. That's why doctors a lot of times try to restrict sodium to reduce water retention. But if you don't have high blood pressure, taking extra salt might be good, and you might feel better. So
Doesn't matter what kind of salt.
what kind of salt? Actually, any type of salt would work, and so but a Himalayan salt would be my preference, on that. Yes. So, but any type of salt, can work, for that basic type thing. So we want to make sure that we're getting basic hydration, mineral-rich foods, and actually comes back to absorption of nutrients. We're going to talk about that in just a little bit. Make sure that you're absorbing the nutrients, that you're digesting those nutrients. Stress management, another whole topic to go into sometime, and then also increasing salt. Supplements that may help out for the adrenal glands. Matter of fact, my goal with my clients is to support the adrenal glands and help them to work. So I actually like to go with more like vitamins and minerals to help them to recharge, to work better. And then we can go into herbs if need be. So some of those vitamins and minerals include vitamin C, vitamin B5 called pantothenic acid. And matter of fact, it actually takes pretty high doses of pantothenic acid to help out with the adrenal glands. We're talking about over 250 milligrams a day. So to see an effect of that. And vitamin B6 and magnesium. So those are basic nutrients I will give, and I've seen many times the adrenal gland sodium numbers get better. Dizziness, not as much of an issue. But we can get into, if a person has a more of a long-term chronic issue of adrenal issues, we have ashwagandha, rhodiola, licorice root, also very good at that. So
Those are ashwagandha and rhodiola are just awesome in general.
Yeah, they are.
They're so good for you.
So I do take the ashwagandha on a regular basis to help me to sleep, through the night, so I will not wake up at 3 o'clock in the morning. And so it helps keep my cortisol from going high ahead of time. And then licorice root's kind of interesting. Licorice root has a tendency to also to help actually increase cortisol levels and some water retention and some mineral type things. So once again, we have to be careful about these supplements, about timing, doses, and then follow up with a test. So be careful about trying to do these things on your own, but always seek help with a person that is familiar with your health issues and can monitor that. By the way, before I forgot to mention this earlier, if you have questions, be sure and submit those, and Betty's going to print those off. And so because we can't see your questions coming in, we have the phones too far away, and so at least I can't see them. And Betty's going to capture those questions and print those off, and at the end of the session, we will go over those questions.
Kind of off topic, but tied in with the cancer piece, with the licorice root and the cortisol increase. Would that help people that have had damaged adrenals from chemo recover versus taking steroids long term?
It definitely could, yeah. So the licorice does increase cortisol levels and helps it to recover, and so it's a common herb that I use, for people I know, especially with low cortisol levels. Versus me, sometimes I'm in more of a little bit more of a stimulation over too much cortisol, and so I'm trying to do more stress management and decrease the number of hours I work and things like that, trying to help keep that under control. So low albumin and or low protein, common number in blood tests. And so if they're low, that can indicate poor nutritional status, or maybe even some inflammation in the body. But if you're not absorbing your nutrients, you're going and or not getting enough protein. So that's actually a pretty common issue. I find a lot. I have a lot of people that because of maybe stress or chemotherapy, whatever, and they are not hungry, and they're just not eating right. Or a lot of people are going more into a vegetarian or a vegan type mode, for cancer, and they may not be combining their foods properly and getting enough protein. But most common, what I find is that most people with a low protein and albumin number is they're not digesting their food right. And that comes back to the betaine HCl as far as supplements go. But so make sure that you're getting enough protein, throughout the day. I have on my website a palm rule guide for making sure you get enough protein. So if you have a piece of meat, typically a person needs a piece of meat for one meal out of 3 meals a day. A piece of meat has to be the size and the thickness of the palm of your hand. That's 1 out of 3 meals if you eat meat. If you have vegetable sources of protein, it actually takes 2 palms of beans or legumes to get enough protein for 1 meal. So if you're eating, doing more vegan, vegetarian, you've got to be more mindful, of that. I've actually seen more people with health concerns that are a vegetarian or a vegan because they're not combining their foods right. So you have to get enough protein, with that food, and then you have to make sure that you're absorbing it. So the stomach, when the food goes in, the stomach's supposed to make hydrochloric acid. We can supplement that with betaine HCl. I have a challenge. We have information about that on the website, the Learning Center, once again, about doing these challenges to see if you have enough stomach acid. And then sometimes, then that to the betaine, actually the HCl part of that, turns the food into a liquid, and it empties that into the intestines. So now the pancreas and the gallbladder are going to do their job. Matter of fact, if there's not enough stomach acid, the pancreas and the gallbladder don't know the food's coming in. So we have to have enough stomach acid for the pancreas and gallbladder to do their job to finish with the absorption of nutrients, including protein. So the pancreas does make protein enzymes that helps finish off that digestion of the foods so we can absorb those proteins and amino acids. So supplementing with protein supplements. I have some clients that aren't getting enough protein, so we have to supplement, and protein powders, making a fruit or veggie, greens drink, a smoothie with protein powder, a great option for a meal a day. I think variety is important. You shouldn't just rely on those by themselves. And then the betaine supplement, protein with meals, make sure you're getting enough and snacks. So taking the protein, the betaine, HCl with protein, but even if I have nuts and seeds, those are hard foods. And I chew them and chew them and chew them and chew them, but still there's kind of chunks. And it takes hydrochloric acid to dissolve that and turn it into a liquid. Otherwise, it passes through. So God actually made nuts and seeds to pass through the digestive system so animals can redeposit that, throughout the land. So they are kind of hard to digest. We need some help sometimes. I do need to take that. And then also potentially branched chain amino acids. There are studies showing that senior citizens, that they will give them just actually a branched chain amino acid, a powder, not a full protein powder, but just that, and literally their grip strength improves just after they've been taking that for a couple of months. So they can actually grip things stronger. These are people that are in wheelchair type situations, and they're weak anyway, but that's just a sign that they're not absorbing their proteins. So really, they need to go back and do something else. They need to increase their protein intake and make sure that they have enough hydrochloric acid in their stomach. As we get older, we lose that ability. The immune system can attack the lining of the stomach, and we can lose that ability to make hydrochloric acid.
And I'd say on the protein powders, also make sure you're not getting some. There's a lot of stuff. In fact, I'm guilty of it. I just threw 2 huge jugs of it away that are polluted with extra sugar to make it palatable. So be careful, because you may get a really high carb intake that you're not intending.
Yeah, so be careful about those carbs and stuff. I'm gonna put this mic over here just so it help pick up on the Facebook group. So so definitely we want to be careful about those carbs and what they mix those with, and bad oils. And so I'm a pretty simple guy, and therefore, like even the protein thing, I just basically like the idea about putting, take some fruit and or vegetables, and water, or a nut milk, protein powder. If you have to sweeten it up, use a little bit of a natural sweetener, with that if you have to, but keep it simple versus a pre-mixed type of thing. So liver enzymes, a very common issue that we find. Liver enzymes, AST and ALT, can be elevated with liver damage. So actually some people and even medical professionals call it a liver function test. It's not really function, it's actually measuring damage. So when the liver is damaged, these chemicals come out, from those damaged cells, and can be caused by medications, treatments, drugs, herbs, infections, virus infections, bacterial infections, fungal infections, alcohol, fatty liver. We'll come back to the most common cause of fatty liver is actually blood glucose issues.
Yeah, in fact, I was just listening to a researcher on this, that non-alcoholic fatty liver disease has overtaken alcohol-induced fatty liver, and 20% of our children in the United States now have non-alcoholic fatty liver disease.
Yeah, exactly. So it used to, many years ago, it was only alcoholic, issues. But now, matter of fact, I rarely actually see an alcoholic liver disease. It's always blood glucose issues, and that fat actually infiltrates and gets into the liver and starts damaging the liver. And actually, there are scans that they do for that, and they can see that in those scans. And so it is actually extremely common. Let's see. Also, toxins. I've seen it happen actually with chemical toxins, like yards being sprayed and trees being sprayed with insecticides, and that coming over into the neighbor's yard when they're outside. I've seen liver enzymes go up with that. Also, gallbladder, bile, pancreas issues. So actually, some cancers, can create some or growths inside the body can actually create and clamp and block some of the bile ducts coming out of the liver. The liver actually makes this caustic bile, and if any of those ducts are closed off, now that bile backs up into the liver and starts damaging the liver. So once again, we got to seek help. If these numbers are high and they keep going up, we've got to figure out why, with that. So, question.
Can I interject here? And a lot of people don't have any idea of what hyperbarics will do, but it's amazing how many people have come in here with fatty liver disease, and they were at the end, they were getting ready to go on the liver transplant list. We've had 2 of them come off of that list by doing hyperbarics. The liver, as you always talk about, will regenerate if you do the right things. If you keep impacting it, it can't regenerate. But when you start doing the right things, and then you add hyperbarics to it, you're going to accelerate that recovery.
Yes, right.
And kidney function as well. You've worked with a lot of our clients on kidney and liver function, and hyperbarics can be a game changer.
Definitely, and definitely part of that picture is also going to be the other whole body experience, because you're talking about more like foods and lifestyle, and so you're not just saying come in to do a session, but like, okay, here's all kinds of things to do too. Right. So yeah, so many different things are important in that. So, but to improve blood supply, so hyperbaric. Matter of fact, another thing, and I'm trying to mention this most of the time, because right before I do this session, I take my supplements, repurposed medications, to get that into my body, because my blood vessels are going to be getting bigger and improving circulation, and I want to get those items into my body where they need to be. So taking these items before hyperbaric or even a hyperthermia type treatment, great options, for doing that, timing for that. And then to decrease the issues with that, well, sometimes we have to decrease medications, evaluate that, treat infections, and once again, lower blood glucose levels, very important, and especially for the fatty liver type issue. So abdominal fat is one of those signs about the fatty liver. So it's actually called visceral adipose tissue, and so VAT, and that VAT it actually kind of does create kind of a push out. But the same thing, the liver is over here too, and that fat gets in there and inside that. It comes from too many calories. If we have too many calories floating around, our body says we got to get rid of it because it's going to damage our body, and so it's going to store it in fat cells. And especially that visceral adipose tissue is one of those signs about a blood glucose issue. So supplements I like to use, for the liver enzymes, include milk thistle. It's amazing at how well that works. It is also has some major anti-cancer actions. N-acetylcysteine, NAC once again, curcumin once again. Ultra Botanica has one of my favorite supplements that I've taken for many years. It's actually available through professional healthcare providers. It's called UltraCur Pro, and it's got curcumin with NAC. It's amazing how well that works.
We do one with hemp and frankincense as well,
Okay.
combined Kirky hemp
Okay.
product that's similar things, but all anti-inflammatory and major attack.
So what is it? Is it UltraCur Advanced? Which one has the NAC in it?
It's the UltraCur Pro.
UltraCur
Yeah,
Pro, okay.
And then we've got the regular UltraCur, which is bound to
Okay.
whey protein, but they're
Okay.
both highly bioavailable.
Yeah, and then TUDCA does also have some benefits for gallbladder, and liver function and repair of those in lowering those enzymes. Artichoke leaf, probiotics, and methylfolate. So methylfolate helps the body to detox. As a matter of fact, I've also seen, if I forget, sometimes I've actually seen liver enzymes get better when a person increases their protein intake. Mm-hmm. Protein provides amino acids. Amino acids are the building blocks for our body, and we have to have those amino acids. So I've actually seen people lose weight, blood sugar control better, and liver enzymes get better when they increase their protein intake. Now we're not talking about high protein. We're just talking about the minimal amount that they need. So it's common, especially in women and in older women, that they're trying to cut back too much on protein intake. So protein is very important. Without going overboard, and so for those of you with cancer, often if you're following me, I still am very cautious about, I don't go high protein, I'm trying to go appropriate protein, and then also I have tactics I use to help keep the body from being able to use the L-glutamine. And I do things like intermittent fasting, short-term fasting, also to help starve the cancer cells, of glutamine with Dr. Thomas Seyfried. And then methylfolate and dandelion root. But the most important I have kind of listed first, but milk thistle, NAC, curcumin, TUDCA, are the ones I've seen the best results with.
I would throw ginger into that list
Okay.
because it's been highly effective in non-alcoholic fatty liver disease stuff, and it's closely related to curcumin.
Yeah, I forget about ginger, and so yes.
It's really good.
And ginger, let me add that to the updated version of this. And then A1C, A1C is an average blood glucose number that's based off of the last 60 to 80 days. But actually, this is interesting. The A1C is actually measuring damage in the body. It's a glycated damage. Glycated is kind of like crustiness, inside the cells. Think of it as like when we make cinnamon toast, we put that butter on the toast, and then we put the sugar, and we put that in the toaster, and that sugar caramelizes. That's what the A1C is measuring, is that caramelized sugar in the body. So the higher that A1C, the more damage to the cells in the body. And so, but it measures kind of like long-term blood sugar levels. I've had people actually with kind of like an elevated fasting blood glucose, and they do okay, on the A1C, because actually maybe due to stress, and they don't even realize it, but the cortisol being high in the morning, I have a little bit of an issue with that. My blood glucose can be on the higher side if I don't take my ashwagandha. But then I follow up with an A1C and often find that they're doing fine the rest of the day. So I may not panic, if their A1C is a great number.
I would say that's a good indicator because it's an average. I'm
Average.
going to say average damage over
Right,
time
average
instead
damage,
of
right.
instead of the bouncing that goes on during the day. So if that's trending down, then you're making positive impact.
Yes, and so that once again, that blood sugar, we've already mentioned that just briefly, or for several minutes rather. Blood sugar, can also actually make inflammation chemicals in the body. Inflammation chemicals are a driver of cancer. Myself, I have an issue with that. I can actually eat some carbohydrates, and if I've had too many carbohydrates, I will get achy, and that inflammation goes up, in my body. And those sugars also create imbalance inside the gut, issues and inflammation, imbalance of bacteria. So blood sugar, we have to be very careful about that. Actions. And so I have what I call the cancer keto diet that I really like. And so it's actually adaptable to a person, whether they are a meat eater, a vegan, or vegetarian. And we talk about the palm rule. You implement that to help guide your protein selections, but we have to have the fiber, we have to have the protein, moderate fats, but we have to be very careful about those carbohydrates. As a general rule, we're talking about that in the guide about statistically about how many people in the United States, with metabolic disorder, and it's
93.4% of Americans have metabolic dysfunction.
So yeah, it's a very common issue.
And I would say you could call that keto for life too, because you call it keto for cancer because you're dealing with this chronic symptom or acute symptom. But if you followed that as a lifestyle,
Yes.
you're going to avoid a number of these things we're talking about.
Exactly. Yes, I eat like that most of the time, and once again, I don't have to be perfect. None of us have to be perfect, but most of the time I'm following that. And also I mentioned about the palm rule. I have that written down on this handout. So the ketogenic type diet, the cancer keto does allow for a vegan and vegetarian type thing, and then following the palm rule all helps us stabilize blood glucose levels and helps us make sure we're not getting deficient in any other nutrients. Increase activity. So after eating, my wife and I were trying to make a point. The night before, after dinner, we went for a walk, to be more physically active. Last night, we went actually shopping, went to the grocery store, went to Lowe's and went to Goodwill. We went, and we walked around. Finally, my wife says, I'm going to stay in the car, and so she's getting tired. But walking, we have to burn those calories off. And even just doing simple things like, I'm doing, heel raises right now. If you do heel raises for most of an hour, you're going to burn like 50 extra calories easy, in 1 hour.
And you're increasing your circulation.
Circulation,
Yeah.
Pumping, get that going. So I try to stand most of the time. So we need to be more physically active. Most developed countries, we have it way too easy, and we don't labor. And matter of fact, I have a lot of people say, "Oh yes, well my grandfather, they are doing what you say may be bad." And they did those bad things and maybe even smoked, but they lived to be 102. Let me tell you, their lifestyle was different than what we currently have. So, they were physically active and working and walking, and we're talking about other countries.
And they
today.
weren't eating processed food,
Processed
and they weren't
foods.
drinking 5 Cokes a day. And
Exactly.
yeah.
Exactly. So many things. And also, so supplements, that we use to help out with that is going to be my favorite, berberine, pathway, 3 and 3 plus are some ones that I use for that, along with alpha lipoic acid. I like to take those before eating. Magnesium and zinc, very important. We mentioned those previously. Matter of fact, there's some studies, and I don't understand how they came up with these numbers, but for many years it's been known that it's estimated half of all adult onset diabetes may be caused by a magnesium deficiency. That's very important. Now, actually, I venture to say zinc is another one that's very important for that too. and I find almost all patients with some blood sugar issues are deficient in zinc. Chromium, I've seen high doses help out. I'm a little cautious with that. I've seen some benefits with it, but I think I just want to be careful about going overboard with that chromium. Probiotics, gut health, EG, CG, resveratrol. Also taking the EG, CG, and resveratrol. Pathway 4 has that in there. I take it before meals to help decrease or slow down the absorption, and decrease absorption of carbohydrates.
I would say too, on your probiotics, make sure if you're going to buy them, make sure you're buying a quality probiotic. And I'm just going to revert back to Supergut. And go ahead and ferment them and get super doses where they might really repopulate in the gut instead of pass through the gut.
Yes, that's right. So very important for the gut health. Okay, and then lactate dehydrogenase, or LDH. This chemical is released also when cells are damaged in the body. And so, for example, it could be heart issues, auto accident, sports injury, kidney, liver, even red blood cells can release this lactate or lactic acid. So many different things, but I'm going to concentrate just a little bit more on cancer. So cancer cells actually do make more of this chemical, and that lactic acid, a lactate, also kind of creates a shield around the cells and the tumors, and creates an acidic environment and keeps the immune system from attacking the cancer cells. So it is a marker that I do like to use to help out with that. Matter of fact, it just dawned on me too. I did forget another one. Let me write this down. So that's alkaline phosphatase. ALK-PHOS is an abbreviation. That's another one. So ALK-PHOS is typically in this basic panel. It is a marker, a chemical that's released from bone cells when it breaks down. And when a bone cell breaks down, it releases the ALK-PHOS. If there's tumor metastasis into the bones, ALK-PHOS will go up. Osteoporosis will create a high number. So, matter of fact, in the United States, a measurement of 100 is kind of I consider it to be a high normal number. I'm actually becoming concerned if ALK-PHOS is 100. 150 is considered to be high, but at 100, I'm seeing significant bone loss going on. Now, also that marker, if it's low, tells me that the person is not physically active. They're not challenging the bones. Now, children is a different case. So children, their bones are growing, and their numbers are always going to be higher. So they actually have different ranges for children, on that. But anyway, I forgot to put that in there. I'll put that into the handout, and so that will be on my website.
When you're saying physically active, you want like resistance,
Yes.
Pounding or resistance.
Exactly, yeah.
Not
Not just general walking.
Yeah.
Yes, it takes resistance. And so minimum of, I have some clients that, can do a rebounder, matter of fact, there's some businesses now that actually have osteoporosis type programs, and their goal is actually to, they have vibration plates, and they have special type of exercise that kind of jars the body some to stress those, the bones to help them to grow. And they do like a short therapy, once or twice a week, and can show some benefits in the bone density. So walking isn't enough of an exercise. We have to get our heart rate up. We have to kind of break up, or kind of jar the bones to get some better results. I'm sorry about the ALK-PHOS. So they're very important. So the LDH, it actually encourages the cancer cells to grow, and we want to monitor that. So if we have to get a baseline on all these numbers. If LDH is also not part of a standard blood test. It is a separate test. Almost all these others are, but the LDH is not. It's a separate test, but it's not very expensive. I have a link also in this handout that goes to a lab test that does this, but it may be $30 if you get it without insurance. And it's kind of a challenge to get a doctor to do the test. So sometimes you have to be in charge. If they won't do it, you may have to go do it yourself. and get that LDH. Cancer markers, I'm just going to be very brief on the cancer markers because there are many different cancer markers. And so if the cancer marker is elevated, then that's a sign that that cancer has what's called an antigen, something that can be measured in the blood, showing that there's a lot of those cells going on. So you can use the cancer markers to track the results and give you an idea how things are going. And then I put like on the handout CA-XXX, and actually that means because there's typically numbers and dashes after that. So that's what the XXX means. I have a few examples written down. Vitamin D3 and K2, very important. Vitamin D3, if you can't rely on food, food will not give you enough. You have to be either outside, full body exposure, to get enough vitamin D every day. It depends on the time of the year. And skin tone. The darker skin a person has, the more time they have to be outside to make their vitamin D. Lighter skin, European, light color eyes means I'm Northern European, and my body was made to be, to where after 15, 20 minutes, I got my vitamin D for the day, because I have to maximize that exposure because there's not much sunlight, in Northern Europe. So vitamin D levels are very important. We want to be careful about going overboard with that. Optimize your sunshine exposure. We talk about sunshine, grounding, important, being in nature. I try to be outside as much as possible, and even just walk around barefoot, grounding.
I was going to say, you could just start your day. If you have morning sunrise, grounded, you can get sun exposure, you're going to reset your clock, you're going to get your grounding, and put your phone away, and use that as just kind of a set your day.
That's right. Oh, yes.
30 minute, 40 minutes, set your day with a cup of coffee.
Started my day, cup of coffee, and I turn around and look outside. Beautiful sunrise today. It was amazing. As a matter of fact, I'll post that as a story, and you'll see that photo. It was amazing out there today. So very important to be outside. And then follow up blood tests. Once you start making a change, if you're lean, it doesn't take long for your body to adjust, for your supplement dose. And because actually vitamin D, not really a vitamin, it's a hormone, it's fat soluble. So if you don't have much body fat, it doesn't take long for your level to reach a high amount. That also means that it's not going to be stored in your body very well either. It will go down quickly. But if you have a lot of body fat, it actually will take time, and it actually can take at least 6 months to become a new level. So don't panic if you take vitamin D and you find out after 1 month, it's not working. Don't panic. Your body uses it and stores it, and it may take some time. So you have to just follow up with those tests, and just keep following up with the tests. Now, lab companies are starting to do a vitamin K blood test. And the question is how much vitamin K does it take? We really don't know yet, on that. I do take a very high dose. I take at least 500 micrograms a day of vitamin K, because we're seeing that it takes at least 180 micrograms to have significant, even lower doses will work, but to help pull calcium out of the plaque that's inside the blood vessels. And vitamin K does a better job than D at that, and it moves the calcium into the bones better than D. And then, quality is very important with this. So vitamin D3 and maybe K2, if you buy an inexpensive product, it may not work. So I've actually seen that, or a person took some supplements I was selling, they had great results, and then they got a discount store version, and their blood levels dropped. And then they started back on the better product, and they got better results. So if you've wondered why did it drop, well, think back, okay? And it could be a supplement issue. And then last is going to be about zinc and copper. So there's a zinc taste test that is something that we talked about before, but both of them are necessary. We have to have both of these in our body. They are actually kind of like antioxidants. They balance, they counteract each other. But if we have an excess, it can actually create a cancer growth issue and some inflammation in the body. You have to work with a practitioner. There is a blood test that's available. I have a link to more information about that also. And so typically my goal is actually have the copper just a little bit higher than the copper. And most of the tests I see, the copper is a little bit higher than the zinc. And that is not the pattern that we want. So, okay, that's all that I have, on this. Oh, let's say, summary. Keep track of your lab results. Do the nutrition type things. Adjust and optimize and repeat and test. Use at-home assessments. Monitor the symptoms and let the practitioners, the healthcare team that you're working with, let them know about what's going on. So, blood tests are not perfect. And so just because a number may be high doesn't mean that you've got a disease. I actually had a friend last night. We were going through, thank you, we were going through her blood tests. She was a little panicky. Actually, it was no big deal, when we look at the whole picture and her symptoms.
Yeah, and don't look at it in a silo, because
Right.
you're more than one thing. So you've got to look at it all together to
That's correct. So
discover where the dysfunction.
We
may
want
or
to
may
look
not.
at everything, look at those symptoms. And I want to make sure, healthcare practitioners are important. So they're trained to do physical exams, poke around and look around and evaluate that. So that healthcare practitioner is very important, with that. So ask questions and be responsible, of your health. So we should not just rely on somebody else. That's what my friend, she was waiting for the doctor's office to give her a call, which they probably won't, because once again, there's no major concerns, going on. Some lifestyle things, yes, that she's going to be addressing on that. So now we're going to kind of go into a Q&A. So if you have questions, go ahead and submit some more. I've got some here I'm going to look at. So one person says, I have an elderly client with creatinine 240 and a GFR, so a high creatinine and low GFR. She's on anticoagulant medicine. Her feet are on and off swollen. I do not know what to do. So, pretty broad question. So there's a lot of issues, but there's something that's kind of damaging the kidneys, and coagulant medication. So the doctors feel like there's, I don't know if it's a circulation, there's some type of circulation issue, whether it be a heart issue, leg, feet, whatever going on. But one thing I like to look at is also going to be, especially with swollen feet, is going to be albumin levels. If albumin is low, that means they're not getting enough protein. And so protein is critical, for that. So, so I don't know for sure, with that, but creatinine at 240, so, which is a very high number. It depends on which country I guess you're from also on that. So, another question here in our group. Okay, yes, question.
Question I have, you mentioned Himalayan salt is your favorite salt. I know there's several types. Why Himalayan specifically?
Well, and so actually we're thinking about toxicities. And so recently there's been some questions about some contamination, due to some other sources. And so like Celtic salt, I think is high in lead.
Yeah, it has higher lead.
Has more lead in it. And so, so salt actually has all types of minerals and metals that actually we've not been evaluating. So Himalayan salt is just one that's a little bit more natural and maybe undisturbed, and pristine, versus sometimes some of the ocean evaporative salts, may have more contaminants in it. Okay.
That was going to be my next question, was about the ocean salts, because they talk about the ocean being polluted all the time, and then you hear that, well, I love sea salt. Well, sea salt's got all those contaminants in it, so isn't that going to provide detrimental effects?
Yeah, yeah, that's right. That's possible. And actually, we're just now starting to learn about food. So it is frustrating because we're learning that a lot of foods, come from the ground. The ground has minerals and metals. Okay, so we're going to learn a lot more, and it's going to be a little frightening in a way. But our body is made to handle certain amounts of metals, so we can detox metals. that's another thing we could talk about later, is about testing those metals.
And you need certain metals. I mean,
Yeah, we
you,
do.
You need to function, you know?
Sure. Mm-hmm. Yeah, it's kind of a natural thing. Yes, question?
I have a question. On the vitamin D and K2, how much is a good starting point for the vitamin D?
Okay, yeah. Okay, so how much vitamin D3 should a person take? It depends on the person. I find, and this is, once again, this is average, but we have to do a blood test. We really don't know. But a vitamin D3 of 5,000 units a day is kind of a normal dose. Matter of fact, it's kind of surprising. Back in the 70s, when I was in pharmacy school, you know, they told us if you had more than 400 units a day, you're going to die. Okay? And so now we're finding that we need 10 times that. And so, but they just didn't know because there were not blood tests available. They were measuring, you know, what a 20-year-old that was actually in the service, World War II, they were getting ready to go into the service, 18, 20-year-old, they were peak of their health. How much vitamin D did they need a day to stay healthy? Well, they were also out in the sunshine, you know, playing Army, and, you know, anyway, so that number, as it turns out, also they were very lean at that time. And so, but I'm finding the average person needs about 5,000 units, but then I have a lot of people that need 7,000 to 10,000 units a day.
But 5's a good starting point then.
Often 5 is a good starting point. And I have a few people that actually don't need any. So once again, we got to test.
And I read somewhere that magnesium is good to go with
Yes.
Correct.
D3, K2.
Yes. So vitamin D, magnesium actually helps convert the vitamin D3 that our body makes on sunshine exposure and in supplements is inactive. Magnesium is required to convert into the active ingredient.
So what's the dose on that to start?
So how much magnesium?
Yeah.
It depends on the person too. So, but and so we'll often go with more like about 200 milligrams twice a day. If it doesn't create loose stools, that means you probably need it. Okay.
Okay.
And so about 400 milligrams a day, which is actually the recommended daily allowance.
And is that glycinate or is
Yeah,
that,
there's different there's different qualities, you know, of those, and some are absorbed better. Magnesium glycinate's one of the better absorbed. Citrate is not quite as well absorbed, although I will use citrate actually as a laxative, so because it's not well absorbed, but also that citric acid will help dissolve and break down kidney stones. Okay, and can you juice or smoothie on ketogenic diet? So you can do a berry smoothie, but we have to be very careful. So fruits, you know, matter of fact, I was just looking at this at the health food store last night, and so an apple juice, 8 ounces of apple juice can be 120 calories. So we have to be very careful about apple juice.
and it's high in sugar.
It is high in
sugar
sugar.
calories.
It's high in sugar. Matter of fact, apple, it's actually so common, that fruit is so common, and they followed the questionnaires with people with cancer, and apple juice consumption actually increases the risk of cancers because it's too much sugar. Apple itself doesn't, the juice does. So, but we have to be careful about the amount of sugars that would be in a smoothie. So, you know, doing pressed, filtered.
Keep the fiber with it.
Yeah, it's not. I'm not a fan of that. I think we have to be careful about that. We need the fiber. So I like to make smoothies and grinding it up and getting the pulp, the fiber, because that fiber slows down the absorption of it. And then also another little trick, you know, is actually to add protein and fats. And so protein and fats will slow down the absorption of the carbohydrates. Matter of fact, there's a gentleman, I forgot the name of his show, on Instagram, and he actually eats. So he actually ate a bowl of rice and tested his blood glucose with a CGM, and his blood glucose went up like 49 points 2 hours later. Within an hour, actually spiked at 49 points. When he actually ate the rice with olive oil, and I can't remember now, it was a tablespoon or two of olive oil, it went up less than half that.
And then if you time it and eat the fats and the proteins in front of the carbohydrate,
Yes.
it's even more.
Eating those beforehand is very important on that. So
So we have pushed right up to it again, and if there are still questions, maybe we review the questions next week. I don't know what we have on tap.
Yeah, I don't know. I was thinking about talking about stem cells.
Man, and exosomes and
Yeah.
all that. I mean, is that, so I have a lot of, my clients have a lot of interest in that for sure. So maybe we put that on the calendar for next Thursday at 10 or at 11. Get that right? Well, Keith and Josh, thank you again. That's Keith at prevailovercancer.com and Josh at ultrabotanica.com. And can't tell you how much I appreciate you guys being here. Sorry for the technical difficulties today. My Cox, let me give them a plug, is all over the place. My bandwidth is going up and down, so they must be working on something around here. I hope that didn't mess up too much out there in TV land. Well, thank you all so much. We will. This is Paul at Hyperbaric Plus, and that is hyperbaric.plus if you're looking for us online. Love for you to come and dive with us. Come and meet these guys. It is a hoot to get in the chamber and have their undivided attention for an hour. So until next week, Josh will not be here next week. I know he's traveling, right?
I'll be getting my D3.
Yeah, he'll be getting his D3. He's going to go on a D3 journey. Okay, well, thank you all. We'll see you next week.
Thank you.
We'll go from there. Thank you.
So I have a question, Paul.
Uh-huh.